most distal region of the lower limb and the appendicular skeleton. These bones are responsible for the propulsion, balance, and support of the body's weight through many diverse activities, such as standing, walking, running, and jumping. The talus and calcaneus. The talus, which is the ankle bone, which is going to be right here, and the calcaneus, the heel bone, are the two largest tarsals. Most of the body weight is carried by these two bones. The talus is located in between the calcaneus and the tibia. The cuboid bone, which is right here. The cuboid bone is cube-shaped and connects the foot to the ankle. The job of the cuboid is to provide stability to the foot. It is located on the lateral side of the foot between the fourth and fifth metatarsals. It articulates with the calcaneus, the lateral cuneiform, and the navicular. Just remember, it is cube-shaped and is called cuboid. The navicular, which is right here. The navicular bone is located on the top of the foot. It articulates proximally with the talus, distally with the three cuneiform bones, mainly the medial one, and laterally it articulates with the cuboid bone. The navicular is from the Latin root navis, meaning a ship. Just remember, the navicular bone looks like a ship. The cuneiform bones, which are going to be these three. There are three cuneiform bones. Lateral cuneiform, right here, intermediate cuneiform, and the medial cuneiform. These articulate proximally with the navicular bone, and the lateral cuneiform bone articulates with the cuboid. All of the cuneiform bones articulate with all the metatarsals. These are all somewhat cube-shaped, so once again, just remember that cune and cube are pretty close. These bones serve as attachment points for a lot of tendons, so they help to allow movement. The metatarsus bones, which are going to be these right here. The metatarsals are located in the midfoot area and are tube-shaped. The metatarsals are numbered 1 through 5, starting at the medial metatarsal, which is the big toe side, right here. These are found between the phalanges and the tarsal bones.
This red bone right here is the tibia. The tibia, sometimes known as the shin bone, is the larger and stronger of the two lower leg bones. It forms the knee joint with the femur and the ankle joint, with the fibula and tarsus. Many powerful muscles that move the foot and lower leg are anchored to the tibia. The support and movement of the tibia is essential to many activities performed by the legs, including standing, walking, running, jumping, and supporting the body's weight.
What I was currently thinking. All right. We'll be back.
Medial and lateral condyles.
The
The proximal end is roughly flat with the smooth concave medial and lateral condyles forming the knee joint with the femur. The lateral condyles are on the outer side of the body, which is right here, and it's closer to the fibula. The medial condyles are on the inner side of the body, so towards the midline of the body. This is your anterior view and your posterior view. Tibial tuberosity, which is right here. Just below the condyles on the anterior surface is the tibial tuberosity, a major bony ridge that provides an attachment point for the patella through the patellar ligament. Extension of the lower leg involves the contraction of the rectus femoris muscle to pull on the patella, which in turn pulls on the tibial tuberosity. Medial malleolus. On the medial side, the tibia forms a rounded bony prominence known as the medial malleolus. The medial malleolus forms the medial side of the ankle joint with the talus of the foot, which is right here. It can be easily located by palpation of the skin in this region.
We're gonna probably look at your room tonight.
Fibula, which is this red bone, which the arrow is in the wrong spot. The fibula is the long, thin, and lateral bone of the lower leg. It runs parallel to the tibia, or shin bone, and plays a significant role in stabilizing the ankle and supporting the muscles of the lower leg. Compared to the tibia, the fibula is about the same length, but is considerably thinner. The difference in thickness corresponds to the varying roles of the two bones. Most proximal end, just below the knee, is a slightly rounded enlargement known as the head of the fibula.
And double check
The head of the
to
fibula
make sure
forms the
that I
proximal
don't have
superior
schools seeing
tibiofibular joint with the lateral edge of the tibia. From the head, the fibula extends slightly medially and
so like here,
anteriorly
4 is seeing
in a
6
straight line
is
toward the ankle.
They can't see it anywhere else here
Lateral
or here.
malleolus. Upon reaching the ankle, the fibula swells into a bony knob known as the lateral malleolus, which is right here. It can be seen and felt protruding from the outside of the ankle joint.
We're gonna be in here, Brad. And that's my round.
Does it stop?